Hello, Michigan HOSA members. My name is Sakthi Vijay, and I'm your HOSA State Officer, Director of Communications. Today, I'm here with Aanya Shah, our Director of Membership, as we interview Dr. Anna Mathews from the University of Michigan, as she tells us about her career as a clinical researcher and doctor through her path in nephrology. Go ahead.
Hi there, Michigan HOSA members, I guess. My name is Anna Mathews. I am a nephrologist by profession. I work at the University of Michigan Medical School. I'm happy to share my career path and experiences with you guys, hopefully all aiming to stay in career path of STEM and looking to bright future careers. So I started my training, my med school in India, and then joined my residency here in the United States in 2001. I did internal medicine and pediatric training at University of Illinois at Chicago. At that time, I met a couple of very impressive and helpful mentors in nephrology, which is a specialty in kidney diseases, which prompted me to want to train further in the subspecialty. And I applied for fellowships, and I started a double fellowship in internal medicine and pediatric nephrology at University of California, San Diego. So it was a 4-year fellowship, after which I came to Michigan. This was my first job after fellowship. I joined Michigan as a clinical lecturer, and then was promoted as assistant professor in the division of nephrology, internal medicine. I spend my time doing many things. That's something grown-ups do. My time is spent predominantly running a research lab. I have PhD staff under me. We work towards a goal of finding different aspects of kidney disease. The rest of the time I spend seeing patients who have kidney disease, either in clinic, in a dialysis setting, or inpatient setting. So that's how my time is spent. A little bit about my research agenda. So my time is spent devising experiments, writing publications, writing grants, in the goal of finding the risk factors of heart disease in kidney patients. A little bit of background on why I chose this to research this aspect. Kidney disease is very prevalent. It's 15% of the US population has kidney disease. And these patients have high mortality. Their life expectancy is 2/3 of their age and gender and race matched cohorts. That means a person who has a life expectancy normally in the US of 78, 79 years. If you have kidney disease, your life expectancy is cut down to 2/3 of that. So that's a dramatic drop in lifespan. That's predominantly because of heart diseases in kidney patients. It's 30 to 40 times more than the general population. Also, it's an expensive problem because to put it in numbers, because people appreciate numbers, our Medicare budget, which is the federal budget to take care of patients above 65 years and older, the Medicare budget, 1/4, that is quarter of the Medicare budget, is spent on kidney disease. Okay, so that translates to $80 to $120 billion, which in calculation is 1% of the GDP, or gross domestic product. That is, for every $100 the US produces, $1 is spent taking care of kidney patients. So it's an expensive and clearly a health issue if you're losing that much lifespan. So that's why I'm passionate about this field of study. And what do I do about that? So I have spent my non-clinical years training for research in this field using a technique called metabolomics, which is a method of measuring small molecules in tissues and blood using a very sophisticated machine called mass spectrometry. I use this technique in various different platforms. I use patient samples, plasma, urine, tissue, from mouse models that we have designed and genetically manipulated to reflect kidney disease and in cell cultures, so that we get to the bottom of why our patients are dying of kidney heart disease. So that's how I spend my research. How am I able to do this? For this, I have to apply for competitive grants, and the NIH, the National Institute of Health, is currently supporting my lab to do this research, and multiple foundations and pilot grants also help. A lot of brilliant and very enthusiastic students form part of my research team. I also take pride in teaching students in the clinical arena. I teach residents, fellows, medical students in the clinical aspect. Then I do a lot of administrative work, in a sense that running all these programs requires budgeting, management of personnel, hiring, firing, so on. So that's how my day goes.
Anya, would you like to go ahead and ask our first question?
Sure, I would love to. So our first question is, what first made you fall in love with your field?
So a little bit about nephrology to understand why I love nephrology, right? So nephrology is kidney disease. The kidney is the most smartest organ in the body. It's a little bit biased coming from me, but I stand by it because it has multiple different cells and mechanisms that the only goal of it is to maintain the body in its steady state. And the word is homeostasis. Okay, you probably have come across that in biology somewhere. So the reason why your blood sodium is 135, potassium is between 3.5 and 5, calcium is between 10 and 12, everything has a range, Spartan chemistries, it's because the kidney maintains itself, okay? Unlike other organs, for example, the heart, which is a muscle that just has to beat, or the GI tract, not to diss other things, but I have to be honest, the GI tract has only to absorb the nutrients. The kidney has to constantly keep itself in check. These numbers are just a few examples. In addition to maintaining electrolytes, the kidney maintains the acid-base balance in the body. So the reason why you're able to excrete the excess acid and base that you ingest is because of the kidneys. The kidney also maintains water balance. The reason you're not swelling up when you drink a lot of water is because the kidney manages that. The kidney also maintains your blood counts. It is an organ that senses how much blood cells to be made, how much blood cells need not be made. So that important function is also in the kidney. The kidney also is involved in bone health. So as you can see, I can keep listing this forever, but the kidney is quite involved in many aspects of the body. And the failure of the kidney will lead to not immediate death like other vital organs, but it will cause death within a few weeks. So, and it's the only organ system where since 1970s, we have a reliable method of replacement. In a sense that if your kidneys fail in this country, we have multiple modalities to keep you alive. We have dialysis, which there are 3 different kinds of. We have transplantation, 2 different kinds of transplantation, from live people, from dead people, donated kidneys. So in a sense, I see it as if your organ system, as in the kidney, fails, I have means to keep you alive. It's not a perfect life, but I still have means to keep you alive. I can keep alive babies born immediately with no kidney function all through their lifespan. So I found it a very hopeful kind of feel where I can offer hope to my patients. I also found it, the numbers and the homeostasis a very intellectual challenge because there are multiple mechanisms that maintain it. And if you guys ever have a chance to learn kidney physiology, it's tough, but it's very, very intuitive and you'll gain a great respect for the kidney. The other thing about the kidney is it's a well-researched organ. A lot of mechanisms have been understood, but there are tons of mechanisms still to be learned. So there's a lot of research potential, still a very complex organ that things have not fully been understood at. The other thing about kidney patients is once you're a kidney patient, you are a kidney patient for life. So I allowed that forming of relationships with my patients for life. If they start as a child, then all through their life, they have kidney disease. And I allowed the concept of being their anchor in managing their care. A lot of relationships were important to me, clearly, because I did Med-Peds residency. And along the way, I met great mentors. And that has been how I chose many things in my life. And I strongly suggest that you make decisions in life after finding role models and asking right questions and knowing everything about it. So in that sense, I met great nephrology mentors who guided me through research and clinical medicine. So those are the reasons I chose nephrology.
Thank you so much for sharing. Our next question was, how long did your training take after medical school?
Long. As you understand, assuming the audience is all high schoolers, the first step to starting towards a career in medicine, whatever level, is choosing undergrad that's competitive and gets you all the required courses that you can apply for an MCAT. After an MCAT and multiple interviews, you get into medical school. Medical school is 4 years. After 4 years of medical school, you apply for residencies. Residency is a requirement in the United States to practice. So no matter what field you choose, you will do a residency. Those can be of many durations. The most, at the minimum, it is 3 years. And the maximum, it could be 7 years, depending on the field you choose. For nephrology, it's internal medicine. Treat adults. If you want to treat children, you do pediatrics. Or if you want to do both like me, you do both the residencies together for 4 years. So I trained 4 years to do a double residency. After which I decided to specialize in nephrology and kidney disease. So you do a fellowship. If you want to do an adult nephrology fellowship, it is 2 to 3 years. A pediatric nephrology fellowship is 3 years. And I did a combined fellowship for 4 years. So I did, after med school, 8 years of training to be where I am. So it's not a field for the faint of heart or the impatient. There are lots of ways to make money, as you probably see around you, and quicker and better ways to make money. The reason you should choose my specialty is because you care. You care about that patient suffering, because when your pager goes off at 3 a.m., you need to answer it without grumbling because you want to be there. So I think it's a great profession to help people, especially in nephrology when they are facing death, honestly. So you are guiding them towards therapies that they've never heard of, never thought of. And that sort of important position in their life is yours. And that bond is long-term and people appreciate it. And you shouldn't be doing it for appreciation anyway. You should do it because it makes you feel good. And that's what you want to do. And science by itself is intellectually challenging. And the reason I do research is because I can do more than treat one patient at a time. I can unravel a little bit more of the science that we are finding out. And maybe it'll make a huge impact like the mRNA vaccines that is saving the world right now. Or maybe it gets to know one small mechanism that nobody thought of, or it's a step towards further processes. So that's why I do research. And medicine is long training, difficult training, but it's entirely satisfactory. It is also the only job that will never go into recession. Your job is always there as long as they're humans. So it's a recession-proof job and quite flexible because there are different roles you can achieve at the end. I told you about my job. You can't find 2 other people in the world who do the same thing I do, because people do various combinations of these things. They can decide to do inpatient nephrology only, or only see patients in clinic, or only see dialysis patients, or only do research, or only do clinical work. There's so many combinations and permutations you can do. So it's quite flexible in that sense.
Another question that we have is, this just popped up as you were talking about kidney donation from one person to another. I remembered that HOSA has a collaboration with the Gift of Life, who's an organ donation organization. And I was wondering if you could talk about the importance of organ donation just to all of our listeners.
So at this point, there are 650,000 people on dialysis waiting for a kidney transplant. So, and the mortality rate in our country, you know, from different reasons. So the simplest thing to do is to sign up for, you know, donation at the event of death. That is easiest thing to do. It is something you do when you get your driver's license. You check a form there, and it indicates to people that you will be interested in such thing in the event of such unforeseen circumstances. But there's a lot of misinformation out there about what happens. People do not trust the health system sometimes. But it's something to think about if your organs are usable in the event of an unfortunate demise. It's something to leave your loved ones to think about, right? If you indicate, you guys are too young to think about it, but something to talk to the rest of your family as well, that when they make instructions in the time of death, like a living will or a health power of attorney, that they indicate that, yes, I would like to donate my organs. That's the simplest first step to take. The rest of the questions are all medical, whether your organ is acceptable, whether it can be used. But the first initial barrier is your indication that that's something you would think about, right? That's what you're saying in the DME when you sign up. So I encourage everybody to do that. The next aspect is living donation. A lot of people are looking for kidneys and are looking at altruistic efforts, or your friends and family members who have kidney disease. You can donate your kidney if you have positive blood match, and for the testing that you can donate if you're healthy. So that will change somebody's life completely, like 180 degrees. As I said, all this heart disease risk we talked about, all that will disappear and get better with the kidney transplant. And that's another reason why I love nephrology, because we can do that. We can change people's life with a simple, it's not simple, but a procedure and care like that.
Thank you so much. My last question is, what are some cons and disadvantages to your occupation? It doesn't necessarily need to be the sad parts, but what annoys you and what makes you annoyed?
Tons of things annoy me, but I don't think you guys need to know all of that. Cons of my profession. What you're signing up is not a 9-to-5 job, right? So, and there is no hourly work. I mean, though in some sectors they might try to do that, but really there's no hourly work here. This is a 9-to-5 into weekends kind of job. And you do it because you like it and you care about the patients. This last Labor Day, I spent in the hospital taking care of patients. So if you are a kind of person that loves your holidays and never want to work on the weekends, this is not the place for you. Obviously, there are certain aspects of medicine you can still find that. For example, if you choose pathology, which is not seeing patients, but once there's patient contact involved, generally this is not a 9-to-5 job. So that's a big con. If you think of work-life balance, which you're not thinking at age 20, but believe me, at age 40, you are thinking about it. That's the big con. And if you hate your job and you're working on a weekend, that is not a good combination. But unfortunately, I like my job. But then there are situations where you are planning around your schedule. There's another spouse's schedule to think about, your children's schedule to think about. So it can get tricky. So you have to find ways to de-stress, ways to take it easy. block out time to say, this is my time and I will not be dealing with patient issues at this point. So the reason you're carrying around a pager or contactable by mobile all the time is another issue. It's never there is no big line drawn there. So, but there are ways to set aside time for yourself and your family and draw lines. But generally, this tends to bleed into your life. It's not, and it is because the kind of person who signs up for this is also the altruistic kind, right? So you're not going to say, oh, I'm sorry, it's 5:30, I'm going home. No, that never happens. So in that sense, it could be trying. And also the con is, we talked about this, you have to train. I'm just thinking about my training, but at least 11 years to start touching a patient. So, right, so it's a long process when you're not getting paid and your loans are mounting. So, but at the end, you get a very highly paid job. You clearly will repay all your loans, but it requires that kind of patience and waiting attitude towards that. And there are sometimes you are in positions where you are at the making life and death decisions. You necessarily may not want to be there. It's not a more comfortable place to be, but you are there and you have to be their patient's advocate at that point. So that's a hard thing to be, especially in fields like oncology. It's a very hard thing to be. And this constant awareness that your decisions could actually, a wrong decision could cause harm. So you have to be constantly at, it is not a number in a spreadsheet will not cause harm, but the wrong prescription, wrong dose, wrong diagnosis can cause harm. So it's a very responsible job. And the physician's role also is constantly managing people. There are going to be nurses, PAs, physician assistants, MAs underneath you, lab techs, radiologists, and the research aspect has tons of people working for you. So you're responsible for decisions that can cascade down to a lot of people. So it is not a carefree 9 to 5. Sometimes can get heavy on the heart kind of job, and it requires a lot of training. And that's why it requires a lot of training.
Thank you. Our next question is, what does an average day look like for you?
Oh, that's hard to say because some days, like on the weekends when I did coverage for the hospital, it's seeing patients alone. Some days it's a combination of seeing patients and running my lab. Some days it's clamping down and writing the papers and meeting deadlines. So it's completely varied, which is why I love research. It's not very tied to patient schedules, but if I was doing completely clinical work, it will be based on patient needs, completely responding to them. Yeah. I wanted to say something.
Go for it.
Sorry to interrupt. This is a people-based job. People forget that. You will be constantly talking to people or dealing with people. If you hate people, please don't pick this job. This is not for you guys. There are other jobs where you can avoid people contact, sit in a Zoom and make lots of money. But unfortunately, I think for me, it is a people-based job. You have to be nice to people. There is a lot of, you will get a lot of bullshit handed to you, but you still have to be nice to people. That's, if you recall all your doctors in your life, they're always nice people. Rude doctors never make the nice cutoff. So you have to be very patient, very pleasant, very approachable, and very calm in stressful situations. And of course, be able to handle blood, which is something people find out in med school. So yeah.
So you mentioned that being a doctor is not for the faint of heart, or even trying to become a doctor is also a tough process. I'd like to ask you, what did you do to keep yourself restrained and not burning out when you were studying? Or
So,
how do you contain those emotions when you're going through something hard?
So you need to learn to draw lines. Of course, you don't, for example, this last year, COVID stressed everybody out. There were tons we could not get done. Hospitals were filling up and all that stuff. During training, there are going to be huge exams and things. The point is to draw lines between work and life. And that's a life lesson, actually. You have to say, okay, this is what I need to do for this goal or get through this day. And I will do it, and I'll do it 120%. But once I leave, I have handed it over to somebody competent, if it's work, or if it's studying, I've done my job and I'm taking my break. So an organization, if you are a disorganized person, a job that's 1 hour will take you 3 hours. And that's something I've seen some of my colleagues trip up on it quite a bit. So you have to be organized. There is no way to get here without being organized in every aspect of your life, personal, work, and you have to look long-term. Your life is not 3 days ahead. Your life is, in your case, decades ahead. So you have to do a lot of planning, ask questions. Sometimes people make decisions without talking to anybody. And I always wonder on that, but get to the point where you're okay reaching out to people, asking questions, because guess what doctors do? They don't have all the answers. I get into a problem, I pick up the phone and call a colleague or call a next specialist. So you should be able to pick up your phone or go up and meet them and ask a question. And that's a good thing, not just in medicine, everywhere. Where you're in college, in high school, you're preparing a college essays, make 3 people read it. How will you know what you're doing is a good job if you don't have opinions? And the thing about opinions is all opinions are not good. All opinions might not be great, but you should be able to take the good from it and shirk off the rest. So be organized, ask for opinions, draw lines in life, and seek for help. One person, I didn't become a doctor just because I wanted to become a doctor. There are a lot of people involved in this. My parents, my siblings, all these ruined holidays, people have to put up with this, right? So it takes a village to be what you become in life, and be nice to the village. Be nice to the village, be organized, don't make their life even worse, and ask for opinions. And there is no right answer in life. Being a physician might not be a fit for everybody. Doesn't mean you haven't succeeded. I have known great engineers and great different kinds. So if this is for you, you need to pick up those skills very quickly, being pleasant, approachable, organized, and planning quite a bit and asking for help.
That was some great advice. Thank you. Our next question is, are there any stereotypes about your specialty?
Oh, yeah. I've had experiences where I walk to the Veterans Hospital here at Ann Arbor, in Chicago, in San Diego, anywhere, and been called a nurse. And I'm like, dude, I'm wearing a white coat. How am I a nurse? So there is this perception that a doctor is male, a doctor is male, Caucasian, and graying. That's the ideal perception. And if you look for ads for hospitals, that's the face on the thing everywhere. So there is this big perception, but it's totally not true. There are clearly tons of female doctors and tons of other races and ethnicities in there. But the perception is that the most competent doctors are male and older and so on still exists. But I hope slowly people are waking up from that aspect. What are the other stereotypes? There is stereotypes that women physicians care more about their family rather than ambitions at work. There are stereotypes like that. And that's kind of hard to break because there is some truth in it as well. So it's a hard thing to break. In academic medicine, men do much better than women. In fact, only 20% of academic physicians are women. So there are different problems with that, a lot of systemic problems that they're trying to address. But it's not going to happen in one generation. We need a lot of kids like you to come in and change perceptions. I don't think perceptions or difficulties going to stop people with a passion. I mean, of course, 11 years of training to medicine, but how many doctors make it? So people with passion will find a way to do it. And there is no stereotype to resist passion. So tons of different kinds of people make it against all odds. And we are Americans, we love those stories, right? People making it against all odds. So I wouldn't let any stereotype or length of training or hardships stop your passion. If that's what you want to do, you plan it, you organize and get it done. Just make sure you like what the end result is. And that's why you should do like visitors observerships, so you see what doctors do and make sure that's what you'd like to do and before you sign up.
Thank you so much. And one of our last questions will be, what advice do you have for high school students, or what are some things they can do to kind of immerse themselves into the medical field and try to get their feet wet a bit?
So my honest opinion is too early to peg yourself into one particular profession. You could make general, as a parent myself, I have a sophomore in college, so I went through all these things recently. I think high schoolers are young and experiencing so many things during high school that sometimes you give in to parental pressures or peer pressure or perhaps family pressure and say, oh, everybody expects me to be in STEM and therefore I will do STEM work. And it's a very common thing I see. What you need to decide right now is that you have a broad track that I love STEM or I love business or I love, clearly you guys are in MIHOSA, so you like health related professions, right? There is no need to peg yourself and say, I want to be X, Y, Z in 10 years. I mean, it's good to have goals, but don't peg yourself so much because you haven't experienced everything yet. What most undergrad applications should look like is that I hope to be that someday, but I want to experience the wide variety of offerings in health professions before I do that. And therefore I take X, Y, Z things to work towards that. I see a lot of kids rushing to shadow doctors or, try to intern in places. I think it's a little too premature. I think that's activity to do in undergrad years because then you have done that biochemistry, organic chemistry, you've done that physiology class, and then you've seen how you do and whether you like it. And then you say, okay, I want to shadow a doctor and see whether I want to apply for med school. So in high school, all you have to show is passion in the STEM field. I suggest signing up for research activities, signing up for altruistic activities that can use your skills. That is, at this point, your skill is being brilliant and young, right? Other than that, you haven't trained specifically for anything else. So go for altruistic trips, provide your manpower, your organizational skills for things. Demonstrate interest in science, participate in science fairs, participate in writing and presenting things, those kinds of things. Don't peg yourself into very specific professions yet, because I see a lot of undergrads who come in with this predetermined goal of being a doctor, and then they realize that things are different and their interests are different. And why not? Why can't you explore things in undergrad? You should. That's the reason you should do undergrad. I've seen people switch totally from one A to Z, and that's okay. And leave yourself room to do that. Don't peg yourself so much Just point to the general direction you want to go. Say, I love health-related work, and that's okay. And that's what you need to do. What's more important is what do you do underneath the health-related interest? Are you showing, interest in research, interest in altruistic work in health? Shadowing physicians is, okay, you're trying to decide whether you want to be a physician, but you are not at that stage of life yet, right? So too early is my opinion.
Right, thank you so much, Dr. Mathew. We learned so much, and we're so excited that you joined us today. To all the HOSA members, I hope you guys learned a lot, and we look forward to seeing you guys next week with our next guest speaker. Thank you, Dr. Mathew.
Take care. Good luck with all your careers.
Thank you.